As the flu season takes shape, the United States is seeing a record number of coronavirus cases. More than 126,000 cases were recorded on November 7th, the most in a single day since the pandemic began. Dr. Malathi Srinivasan joins me now by Zoom to talk about some new developments. So Stanford is joining a phase 3 clinical trial of an experimental vaccine against the coronavirus. Can you tell us more about that trial?
We are so excited to be joining the Ensemble trial, which is a global trial of 60,000 people with countries all around the world to see if a vaccine by Johnson & Johnson is as effective as we think it's going to be. The phase 1 and phase 2 clinical data has been very promising, showing that even just one dose of this particular vaccine at a reasonable dose will provoke a vaccination response with neutralizing antibodies in over 95% of patients. And in fact, in the younger patients, we think it's over 99%. So, there's always a lot of questions about immunizations in terms of how long the immunization effect will last. We know from a lot of the other vaccines that people have studied that typically for, say, influenza, it's between 30 to 60% effective in terms of preventing people from getting the flu. But we're hopeful that this will have similar, if not better, efficacy in terms of protecting people. So we would love to have you come and join our trial. And we're taking about 1,000 people, and people will be randomized to either having the active vaccine or the placebo, and will be followed for 2 years. So it's a very exciting program, and I'm hopeful that we'll come to full enrollment very quickly.
We've been reporting on the surge of coronavirus cases across the U.S., and a new study shows a record number of children are also contracting the virus.
So children contracting coronavirus is a major concern for all of us. Just in this past week, we've had over 60,000 cases of children getting COVID. And in fact, since the pandemic, we've had almost 100,000 children in California get COVID. It's true that children with COVID don't get as sick as adults. And in fact, we know that the rates of severe infection are lower, about 8 in 100,000 for kids versus about 160, 170 and 100,000 for adults. But 1 in 3 kids who gets hospitalized gets admitted to the ICU. And they have a particular form of severe illness called multisystem inflammatory response syndrome in children, or MISC, which happens in a small number of people. And it's really terrible. And it's just heartbreaking when it happens. Children can also get the same sort of severe symptoms as adults do with the pneumonias and the lung failure, the heart infections with myocarditis, and they can even get intussusception, which is a product of having some GI infections also. So the infection rate and severe complication rate, although lower than adults, is still important. However, more importantly is this: children don't exist in a vacuum. They exist in families, and often in multi-generational families. And what we're seeing is that children are transmitting virus to their families. And especially if there's someone in the family who has a comorbid condition that makes them more likely to get really sick, those family members are getting sick. So it's very important to make sure that children follow the same social distancing and hand washing techniques that we do. And if they get infected, they need to quarantine. And I know quarantining for children is very difficult, especially for the younger ones, but it's important for public health and for family health. So with the holidays coming up, I completely agree with the American Academy of Pediatrics recommendations that we should try to avoid holiday gatherings whenever possible. Children have about 11% of all the cases of COVID nationally. And they're not getting tested as often unless they're getting tested through school programs. So we don't know if they're going to pass on the virus to family members at gatherings. So it's very important to make sure that they follow all the same social distancing and other precautions that we tell adults to, even if it's challenging for them. And I think role modeling that at home with parents showing them how to do it properly and how to do it well is the most important thing that families can do. So this is the year that you want to have your family gatherings by Zoom.
A new study by the CDC shows the risk of serious illness among pregnant women. Can you tell us more about that study?
The CDC did a study of all of the people who have been reported to be COVID positive, so well over 1.5 million people in the United States, and had looked at people where they knew if they were male or female who had symptoms, and they took a look at the people who were positive. So, of the about 410,000 people in the United States who were women who'd been tested positive for COVID, about 6% of them were pregnant, and all of these people, of the 410 or so, were symptomatic. And what they did is they said, well, if we kind of take into account age and then race and all of their underlying conditions, what happened to them? Are pregnant women more likely to get sick and sicker than people who were not pregnant? And what they found is, yes, indeed, about 3 times more likely to get severely ill. So if you look at the number of pregnant women uh, compared to non-pregnant women who are admitted to the ICU, it was 11% versus 4%, about 3 times more. People who needed to be on a ventilator, about a little over 2% versus a little under 1%. So again, about 3 times more. And people who had needed ECMO, which is kind of being on a heart-lung machine, was about twice as much as the people who were not pregnant. So being pregnant is a major risk factor for having severe illness. So people who are pregnant need to be much, much more careful about social distancing and about following all of our COVID reduction strategy protocols.
Now that we're getting into flu season, how can you tell if you have the flu or if you have the coronavirus?
It's a little hard to tell when you get sick with an upper respiratory tract infection if it's the flu, if it's the common cold, which is an adenovirus or an enterovirus, or if it's COVID-19. The body has a limited number of ways of reacting to infection and gears up kind of in the same way for most of these fights. There are a few things that are unique to coronavirus that are not unique and don't happen as often with the rest of these viruses, specifically things like loss of smell or loss of taste, developing blood clots. All of those things I think are fairly unique to what we're seeing in coronavirus. However, the rest of the symptoms are very, very similar. So we have 2 messages. The first is get your flu vaccine. And this is pretty much the same as last year. We know that the vaccination for flu saves lives, prevents hospitalizations, and even if the vaccine for any individual is only 30 to 60% effective, as a nation, it has prevented tens of thousands of deaths and hundreds of thousands of hospitalizations. And the second is unique to COVID this year, which is if you're developing upper respiratory tract symptoms, contact your doctor and see if you need testing for COVID or if you need testing for influenza. Many of the health systems, are doing co-testing. So with a single nasopharyngeal swab, they can test for both of those things.